So today we are going to discuss about Helicobacter pylori in details. Okay, so let's get started. So Helicobacter pylori is a bacterium that infects mainly our stomach and causes ulceration. Okay, so this Helicobacter pylori reside in most of the world's population. Approximately 50% of the world population contain Helicobacter pylori in their stomach, but interestingly they do not have any kind of symptoms. So the first thing that we need to discuss about it is the mode of transmission. So the mode of transmission may be fecal oral, it may be oral, it may be zoonotic, it may be waterborne, okay, or can be gastric oral. Symptoms: we can have HS or burning pain in the abdomen, and it become worst when the stomach is empty. Okay, we can observe nausea, we can observe loss of appetite, we can observe bloating, we can also observe unintentional weight loss. Okay, so after discussing about those things, we are going to discuss about ulceration process, how Helicobacter pylori facilitate ulceration. Okay, so first thing is that for causing the ulceration, Helicobacter pylori need to enter into the stomach, right? After entering the stomach, it will attaches with the lining of the stomach. Okay, and these lining are the layer that actually saves other part of our body from the acid that stomach uses for digestion of food, because we all know that stomach deals with HCl, right? So it is too harmful for our other organs, so this layer protects us from that kind of acid, and where Helicobacter pylori likes to bind. Not only that, Helicobacter pylori can survive in the harsh environment of the stomach and causes a kind of damage in the layer that facilitates gastric ulcer or duodenal ulcer. Okay, so let's discuss about how that ulceration process is going on. So the first idea of this is, as the inside the stomach the condition is extremely harsh, the first goal of Helicobacter pylori should be its survival, right? So Helicobacter pylori secretes a enzyme called Uds. This Uds will help Helicobacter pylori to survive in the stomach. How? This Uds will convert urea into ammonia. Okay, as its name suggests, it breaks urea. So as a production of ammonia, it leads to the generation of basic compound in the stomach. Okay, and this basic compound will buffers the surrounding environment of the Helicobacter pylori. As a result, Helicobacter pylori can easily survive inside the stomach. Okay, so that is how they can cope with those extreme harsh condition that is dangerous for other kind of bacteria. Okay, so after survival, the next thing that a bacteria should maintain, that is, it have to attach it with its host cell well, right? So it have some adhesins as a surface adhesion molecule in its surface that facilitates its adhesion with the membrane. Okay, after adhesion, the next goal of the bacteria should be chemotaxis, right, and penetration of the mucus, because it have to penetrate the mucus, otherwise it do not have the ability to break the layer that protects us from stomach, and as a result ulcer do not be formed, right? So Helicobacter pylori needs to break the or penetrate the layer, that is mucus, thick mucus layer, and this penetration can be done with the help of tufted flagella. Okay, this tufted flagella causes chemotaxis and causes this penetration. Okay, and other than that, most importantly, Helicobacter secretes two cytokines known as VAC and CAG, which are two cytokines and which are, remember very carefully, responsible for pathogenicity and infection. Okay, so let's talk about VAC. So VAC first of all acts like a adhesion molecule and it facilitates adhesion. Okay, after that it will bind with the specific receptor present on the surface of the gastric mucosal cell. Okay, and ultimately lead to an inflammatory signal, and this inflammatory signal leads to the production of the inflammatory cytokines, and this inflammatory cytokines brings localized inflammation. Okay, not only that, VAC also bind with the mitochondrial membrane and facilitate cytochrome C leakage, and this cytochrome C leakage will causes apoptosis. Okay, so all these form of things, that means the act of urease, the act of adhesion molecules, the act of flagella, and at last the act of VAC CAG promote further inflammation and ultimately cause leakage of the HCl, or that is gastric HCl, into the mucosa, which ultimately leads to the gastric ulcer or duodenal ulcer and create a pain in the stomach, especially when the stomach is empty. That is the total overall concept of ulceration process, right? So the first goal of Helicobacter pylori should be the attachment, right, in the lining. That lining protects us from the stomach's HCl. Okay, after entry inside the stomach, it also have to survive in that extreme environment. That is why it secretes urease that convert urea to ammonia, and this ammonia will buffer the localized environment so that Helicobacter pylori can happily survive. After that, it will bind with the membrane with the help of, that is the epithelial cell, with the help of specific adhesion molecules that is present in its surface. Okay, after adhesion, it facilitates chemotaxis and penetration of the thick mucus layer with the help of tufted flagella. Okay, and after that, VAC and CAG, that is the two cytokine, promote infection and pathogenicity. How? VAC will again help the Helicobacter pylori to bind with the membrane, acting like a adhesion molecule. After that, it will bind with the specific receptor. Mind it very carefully that it will bind with specific receptor present on the surface of the gastric mucosal cell. Okay, and this binding will promote inflammation. Okay, and this inflammation will lead to the production of inflammatory cytokines, and this inflammatory cytokine will bring localized inflammatory reaction. Okay, that is the idea. And CAG also facilitate various functions that ultimately together leads to the formation of further inflammation, and this further inflammation facilitates the leakage of the gastric HCl into the mucosa, and that ultimately facilitates the ulceration. Okay, and creates a pain in the stomach, and especially when the stomach is empty. That is the thing of ulceration process that you need to know. After that, let's talk about the diagnosis. Okay, so we may take a blood sample. Okay, and inside the blood sample we may look for antibody with the help of indirect ELISA. That antibody specific against the Helicobacter pylori antigen. Okay, we can done stool test. In that stool test, we will look for antigen of Helicobacter pylori. Okay, Not only that, we can also done Uds breath test. This Uds breath test will look for certain compound in the breath, and this compound act as a biomarker for Helicobacter pylori that can tell us whether the patient is infected with Helicobacter pylori or not. Although the most important and best technique is doing an endoscopy. Okay, this endoscopy will look for what is going on inside the stomach. Okay, not only that, it will also take up a sample. That sample can be transferred to laboratory for further analysis. Okay, so that is another type of thing, and another one is very importantly, that is known as Uds test. Here we are using strips, okay, that you can see, and in the strips there will be a spot, and in the spot we have urea. Okay, and that is artificially can be done, this setup, and in the setup we will add our sample. Okay, so just think about that if our sample contains Helicobacter pylori, then it will secrete ureas, and this ureas will convert the urea that is present in the spot into ammonia, right? So you may observe a change in the color into violet if your result is positive. Otherwise your color will remain yellow as it is in case of the A sample. Okay, but in case of B sample the color change is observed. So if the color changes, that means urease converts the urea into ammonia, and this urease is coming from none other than Helicobacter pylori. Okay, so that is how the Uds test is done. So now look at the treatment process. So remember, as it is a bacteria, we will definitely use antibiotic. Not only that, along with antibiotic we will also use a acidity reducing proton pump inhibitor. Okay, that will reduce the acidity in stomach, which can relieve some symptoms of ulceration, right? For example, the intense pain. So antibiotic plus the proton pump inhibitor is the treatment. So antibiotic that we can use is amoxicillin, metronidazole, tetracycline, clarithromycin. Okay, so that is the basic concept of Helicobacter pylori. So Helicobacter pylori infects stomach and causes ulcer. Okay, about 50% of the people worldwide carries Helicobacter pylori in its stomach, but Helicobacter pylori does not causes any kind of symptoms, but if and it can be transmitted by oral, fecal oral, gastric oral, or waterborne route or zoonotic route. Okay, and symptoms may be itches or burning pain in the abdomen. Okay, along with when the stomach is empty, along with nausea, loss of appetite, vomiting, bloating, unintentional weight loss. Okay, so then we have discussed about the ulceration process, and in the ulceration process the first goal will be attachment of Helicobacter pylori with the lining of the stomach. That lining actually helping us to be away from the acids, right, that stomach uses for its digestion purpose. After attachment, it will releases ureas that makes the extremely harsh environment into a environment that can be survivable for Helicobacter pylori. Okay, after that it will have a tufted flagella that will promote the chemotaxis and penetration of the mucosa, thick layer of mucus, right? And after that we have VACA and CAGA, the two cytokines. These two cytokines play an important role and promote the pathogenicity and infection. Okay, for example, our VACA first of all act as a adhesion molecule, then it will bind with the specific receptor on the gastric mucosal cell, and then it triggers inflammation, and this inflammatory reaction leads to the production of inflammatory cytokines that facilitate localized inflammation. Okay, not only that, it will bind with membranes of the mitochondria and causes leakage of the cytochrome C that facilitates apoptosis. So those kind of things together facilitates further inflammation, and that ultimately leads to the leakage of the HCl into the mucus. Okay, so that is how the ulceration process is going on, and ultimately leads to duodenal ulcer and our gastric ulcer. Okay, and it causes intense pain, and especially when our stomach is empty. We can do blood test for checking of antibodies. We can do breath test, also known as urea breath test, then stool test, endoscopy, and the Uds test. Okay, where the color is changing from yellow to red or maybe yellow to violet. Okay, so then treatment, a mixture of antibiotic and proton pump inhibitor for reducing the symptoms and for providing some relief, right? Antibiotic that is commonly used, they are amoxicillin, metronidazole, tetracycline, and clarithromycin. Okay, so that is the concept of Helicobacter pylori, and thank you for listening to this class.